Why do you want to work in aged care? I have a strong desire to make a positive impact on the lives of older people. I believe every individual deserves respect and dignity in their later years, and I find fulfillment in providing compassionate care and support to improve their quality of life. What qualities do you think are important for someone working in aged care? Patience, empathy, communication skills, and a strong sense of responsibility are essential. Aged care workers also need to be attentive to details, physically and emotionally resilient, and skilled in handling sensitive situations. How would you handle a situation where a resident becomes agitated or upset? I would stay calm and composed, listen to their concerns without interrupting, and try to understand the cause of their distress. I would reassure them, use soothing language, and address their needs promptly. If necessary, I'd involve other team members or supervisors for support. What experience do you have working with elderly individuals? I have insert years of experience working in specific roles. During this time, I've assisted with daily activities, medication administration, and emotional support. I've also gained experience in working with individuals with dementia and mobility challenges, ensuring their safety and comfort. How do you ensure the privacy and dignity of residents? I respect the personal space and choices of each resident. I always knock before entering their room, explain procedures beforehand, and encourage them to do as much as they can independently. Confidentiality is also a priority, and I only share information on a need-to-know basis. What would you do if you noticed a colleague treating a resident disrespectfully? I would address the issue immediately by stepping in to protect the resident, if appropriate. Then, I'd report the incident to my supervisor, following the organization's policies to ensure the situation is properly handled and does not happen again. How do you manage stress in a demanding environment like aged care? I manage stress by staying organized, prioritizing tasks, and practicing self-care outside of work. I also communicate with my team to share workloads and seek support when needed. Staying focused on the positive impact I'm making helps me stay motivated. How do you approach residents with dementia or cognitive impairments? I approach them with patience, understanding, and empathy. I use simple language, maintain a calm demeanor, and focus on nonverbal cues like body language. I try to build trust and create a routine that helps them feel secure. Can you describe a challenging situation you faced and how you resolved it?
Once, a resident refused to take their medication. I calmly explained its importance and offered to take it with some food or at a different time. I also informed my supervisor and documented the incident to ensure continuity of care.
What do you think is the most rewarding part of working in aged care? The most rewarding part is forming meaningful relationships with residents and seeing the positive impact of my care on their lives. It's fulfilling to know that my efforts help them feel valued, comfortable, and supported.